are turning to home visits and teleconferencing to provide healthcare support to patients who need long-term care. And this comes as community health posts suspend their sessions as a precautionary measure against the spread of the COVID-19 virus.
31-year-old community nurse Rose Wong usually provides basic nursing aid, chronic disease monitoring, personalised health and lifestyle advice and early detection of functional limitations at the CHP. With the CHPs suspended, Ms Wong now goes on about 5 house visits a week instead. Her patient this time is Mr Mostakim Sam. He used to visit the community health post in his estate regularly for the nurses to pack his medicines and change his wound dressing. But the 73-year-old struggles with managing his medication, which worsens his diabetic condition.
Senang sikit kalau dekat sini kan kita senang pasal apa turun sudah sampai. Kalau mau pergi doktor mau naik bas ini banyak masalah.
On some days, community nurses can even visit multiple households to tend to residents who need extra care and attention.
By providing home visit to resident house, we actually can have a clearer picture of their living conditions. So we can do the assessment that we are unable to do in the community health post, such as home environment assessment, and also identify if there is any needs for home modifications. So by doing all this assessment, we can actually ensure that the residents can live well in the community.
These nurses are also using technology to check on their patients' well-being. A video call software allows them to dial in with their patients and caregivers for follow-up checks.
It complements a phone call follow-up where a patient can visualize what the nurse is trying to show. And it also provides the visual demonstration over video conferencing. It's a more personal than a phone call. It doesn't replace a home visit, but more for patients who needs to have a good visual of what the nurse is trying to bring across.
Such teleconferencing also allows patients who have mobility issues to be checked with ease in their own homes.
We don't have to travel all the way to get the case, which is a little bit far from our home lah. So my dad don't have to move around too much, because if you move around too much, it tends to get very restless. So that's one thing, and then you also can save on transport money as well.
Both the patients and their caregivers believe that instead of waiting for a nurse to turn up at their homes, teleconferencing is a much faster way.
Coming up after the